Welcome everyone, and welcome to our workshop. I will be talking about top tips to getting successful publication. Before we start our workshop, just would like to introduce myself and my colleague. So my name is Veena Daga, and I'm the Medical Director of BAPIO Training Education, especially for training and education in BAPIO Training Academy. So BAPIO Training Academy is the arm length of BAPIO, which is a big organization of British Association of Physicians of Indian origin. Through the BTA, our vision is to promote excellence in healthcare, especially in education and training. And we are aiming to do it by creating more and more and promoting education in healthcare workers. Today, we are going to discuss that what are the top tips to get successful publication. And this discussion will cover three main topics. To start with, getting involved in research, then top tips to write successful publication and how we can submit it. So it will be taking you through the journey from involving any research project or any other project and taking that project up to the successful publication in one of the big journals. All these three talks will be delivered by Ashwin. Now, Ashwin Benkittis, he is a final year medical student from the University of Cambridge. He's very passionate about education and always encouraging student access, and he got plenty of involvement in research. He also so he's a committee member of various university and national organizations, including NANSIG, BOS, and BAPIO. Now he's hoping to have his career and become a neuroscientist, especially academic in clinical neuroscientist. He's also a very good cricketer, musician, and photographer. But today, he will be talking about getting involved in the research and taking to successful publication. We will take question and answer at the end, but I'm happy for you. If you have any question, write down in the chat box, and I'll be answering at the same time. I hope you enjoy it, and hand over to Ashwin now.
Hi guys. So can I just check before I begin, can you just pop a little yes into the chat function to see if you can actually hear me? And if you can see my slides. Perfect, okay. Thank you very much. Back to introductions, I guess. I hope everyone's keeping well, and it's great to see that so many of you have tuned in today to the virtual Health Careers Conference. I'd like to take this moment to thank the organizers for all their hard work in putting this together. And for inviting BAPIO to speak today. So my name is Ashwin, and I'm a final year medical student at Cambridge. And today, my main aim is to introduce you to the world of research. And getting involved in research gives students great opportunities and skills. So I'm going to try and explain how you can get started. Great, so just a bit about my background. I've enjoyed being involved in quite varied research experiences. These have ranged from the lab setting in multiple different countries to clinical projects in different specialties that I've been interested in. And I've been fortunate to have had some success in terms of gaining publications, presentations, and prizes for some of my work. So I just wanted to share some of my tips from my brief experience. So firstly, just to get you all to speed with what research actually is. Research effectively aims to solve problems and to fill in knowledge gaps in disease, investigations, and treatment by gathering evidence or data and information in an organized manner. And there are lots of different types of research that are worth familiarizing yourselves with at this stage. So the first type is qualitative research. And this type of research effectively studies people's behavior, their experiences, and their relationships. And it generally involves methods like surveys or structured interviews. Another type of original research is quantitative research, which is what most people tend to think of when they think of research. This basically involves generating numerical data to test a hypothesis. And when we talk about quantitative research, we generally refer to lab work. And then there's either wet lab work or dry lab work. And in wet lab work, you're working with chemicals, drugs, cells, or animal models. But in dry lab work, you're working with computer-generated models and simulations. This type of research also uses statistics, to compare interventions as well. And this is a great skill to learn if you're going to be going down a research route, because the highest level of evidence, or one of the highest levels, is a randomized controlled trial, and that requires you to use statistical manipulations to compare different interventions. Then there's epidemiological research, which is basically a population-wide study of the occurrence and distribution of disease. And that's more for public health purposes, where you aim to get a bigger picture perspective of what's going on in the population. Then there are review papers. So now these are more common among students, these last three that I'm going to refer to. So reviews, basically, the purpose of a review is to provide a summary of the known evidence base around a particular research question. And so when you do a review with a specific and rigorous search criteria, that's what we call a systematic review. And when you do a systematic review combined with quantitative statistical methods, then that's what we call a meta-analysis. And a meta-analysis is actually the highest level of evidence, according to the Oxford Pyramid of evidence levels. And meta-analyses are what are used to inform clinical guidelines. There are also shorter papers that you can do, like letters to the editor, correspondences, editorials, or case reports. They're easier to get hold of, they're easier to write, generally quicker to write, and they're actually easier to process and publish as well. So I think for most students, I would actually recommend this as a very good place to start when thinking of what publication to go for. There's also audits and QI projects, and increasingly this is a requirement for certain specialty applications. I know for ophthalmology, they like it if you've done a QI project before in a related field. So what audits and QI projects essentially try to do is to assess the standard of delivery of healthcare services and how they may be improved. So to give you an example about that, I was involved in a local QI project in my GP practice, where we were evaluating the uptake of the MMR vaccine in our GP population. And then we looked at whether a simple intervention, like using a text message to encourage people to take up the vaccine, would actually make a difference. So that's something like an audit, where you try and look at the standard of delivery of care and see if there are ways that you can improve it. And it's quite a good thing to get involved in, I would say, as well. Essentially, all research projects then have a similar workflow, these stages that I referred to here. So the first one is obviously thinking of what project you're going to do, the conception phase. So you think about a hypothesis, you think about what objectives and aims you want, and you try and form your research team. And at this point, I'd like to say that collaboration is the best way forward in research, because everyone can bring different skills to the table. So it's beneficial to learn and to work with other people. So when you're thinking about doing a project, it's a great idea to do this with some friends. And I've done this, I've done a lot of projects with friends, and it really does help with the flow of your project as well, and the division of labor. So the second stage would be to write your research protocol, which is generally to do with your methods and whether you need to gain any ethical approval for your work. And then the third stage is obviously carrying out your methods and collecting your data. And then you've got to think about how you might analyze the data, and then think about how you want to present the findings. So for example, do you want to present it at a conference? Do you want to present it at a publication? And as a publication, and if so, where are you going to do that? Are there suitable conferences or journals that would take your work? And then once you've decided whether you're going to go for a conference or a publication, then you've got to produce your work. Generally, you start by making an abstract. And if you're doing a conference, you might be presenting a poster or presenting a PowerPoint presentation. So you want to think about how you prepare that. But if you're presenting a paper or publishing a paper, then you need to think about how you're going to systematically write up your paper. And then you want to submit to the conference or the journal. Now, for conferences, I would say it's a good one because they generally give you quite instant or pretty quick feedback on whether you've been offered the chance to present. But for publications, a lot of them can take time. Because they have to go through a rigorous peer reviewing process before they can actually accept your work. This is particularly true for the original research papers that I talked about, so the qualitative, quantitative, and epidemiological studies, and also the reviews. These tend to take a bit longer to actually process. and by long, I mean it can take at least a year in some cases as well. So it's best to get these done in good time, I would say. Good. So if we move on to the next slide. So this is the pyramid that I was referring to, the levels of evidence. And you can see here that a meta-analysis would be the gold standard of evidence. Good. Okay. So again, if we move on. So why would you think about getting involved in research then, after we've established what research actually is? So what I would say is that getting involved in research helps you develop skills, not only in writing and critical appraisal, but also learning how to process and publish your work. You might be able to present your work at conferences, either as a poster or an oral presentation. You'll develop your skills in time management, problem solving, record keeping, and organization. And because research is usually so multidisciplinary, you get to be involved in a team and improve your communication skills and networking. And you can actually understand how such teams work, and that can be very helpful. And by doing projects, you're actually exposing yourself to an additional depth of medicine, and you might discover an area that you're particularly interested in and an area that you're keen to carry out further work, or maybe even pursue the rest of your life in. And it may be the first step towards an academic career as well. But regardless of all that, all of these aspects can help you gain valuable life skills as well. And it can also help you pick up points for competitive job applications at both foundation program and core training level. And it's particularly important if you're considering a career in academia. Good. So the next thing I wanted to say is that when you entered medicine, you probably wanted to help others and improve patients' well-being. But sometimes when you're in medical school, it may seem that you're not actually making too much of a difference to patient care. So what I would then say is perhaps one of the most important ways you can help in the longer run and in the bigger picture is by getting involved in research, because often your work will add to that best practice evidence base, and that can help improve outcomes for patients in the longer run. So it's quite it's a more tangible way of making a difference at our stage. But some of you may be reserved and think that you may not be able to offer much to research groups. You might think that you're inexperienced. But in fact, I'd like to say that that's more of an advantage rather than a disadvantage. You're actually a valuable asset. As medical students, when we come to research, we have sort of a fresh eyes perspective. We have an inquisitive questioning mindset regarding how things are done and why things are done. And we've got a willingness to learn new skills as well to be able to solve problems. And all of these attributes are very valuable to most research teams. So I would say, look at yourself as an asset rather than a burden to research groups. So many of you may then ask, well, when are the opportunities for me to get involved in research? And there are a few kind of obvious times. So there's the option to do an integrated degree in a number of courses. And these will have a set time set aside for research and dissertation writing. So you might want to think about, well, what type of research attracts you? Do you want to do a qualitative project, quantitative project, and in what discipline? So biochemistry, anatomy, whatever interests you, neuroscience. And then there are student selective components as well, which are these blocks during your clinical years, where you have the opportunity to get involved in an ongoing study or a research project. And I would say make good use of that period to actually find something that you're interested in and dedicate that time to producing an output from the project. And then electives and summer holidays. I would strongly recommend using these well, because they give you a dedicated long period of time, like 2 to 3 months a piece. So it's quite good to actually use it in a kind of fruitful but also interesting way. So for example, for summer projects, there are often competitive summer research studentships that you can look up. The main advantage with this is that many of them will cover the costs of, say, travel, accommodation, and even your stay. You might get given a stipend that will give you enough for your living costs. And then they also give you an excellent sort of framework to get involved in research, because they pair you up directly with a research team or a research group. And you can also integrate with groups of students who get accepted onto these programs, so you'll make sort of lasting friendships as well. So I would say summer studentships are a great thing to look out for. And in your electives, then you could also think about kind of going for an clinical academic placement. and seeing if you can get involved in some research work as well. But the real answer to this question of when to get involved is actually at any time. So what I would actually recommend doing is to just start locally. Get in touch with any clinician or researcher in your local hospital whose work interests you, and then seek out opportunities to get involved with their work. So you can often just chip away at a research project alongside any of your placements, and it's quite manageable to just have that on the go as well. And it adds an interesting dimension to the work that you might be doing. So then if we move on to sort of considerations that I'd recommend. Firstly, you want to ask yourself, well, what are you actually interested in? You want to be involved in something that excites you and that isn't boring. Then you need to ask, well, how much time do you actually have? Do you have, say, an exam around the corner, other commitments that you have? You need to think about when you can actually commit some time to a project and how much time you can commit so that your supervisor can give you an appropriate role in whatever project is going. And then you want to think about what outputs that you want from it. I would say this is quite an important point because we always want something to show for the work that we've done, or at least something that we can refer to in a future experience, and having outputs is the easiest way to do that, and actually the most measurable way to do that. But you can also not just do it for outputs as well. Sometimes you may just want to learn and get a brief insight into research or a new technique or learning a new skill, and you may not get outputs from that, but that is just as valuable for your own development as well. So I would say that's equally important. You just need to know what you want at your stage, whether you want a new skill or are you more concerned about getting a publication or presentation. And then, do you know anyone who's been involved, any peers or medical students in the years above you who've been involved in that research or in that research group? And then you can go and ask them about what their experiences were and sort of the pros and cons of getting involved with particular research groups. And so when you've answered all of those 4 questions, then I would say it's a good time to start thinking about what are you going to apply for, which groups are you going to apply for, introduce yourself to the members of those groups, send out an email, and detail your background, the aspects of that group's research that interests you, and where you might like to take their work a bit further to show that you're an asset to them and you can bring some new ideas to the table. And then you want to think about arranging a meeting with them to discover what potential opportunities are there and how you might take this all further. And remember to attach a well-organized CV to your email as well. So that's a separate discussion I'm not going to talk about here, but it's important to start putting together your achievements in one place and making an organized CV, I would say. So like I mentioned before, I keep talking about these outputs. Well, there are a few outputs that are measured in your kind of applications for jobs and things. So publication, I would say, is the gold standard of an output, and this is effectively just an article that's published in a PubMed ID journal. PubMed is an indexing directory or database. And effectively, why would you want this? Well, like I said, it counts towards job applications. You can get up to 2 extra points on your foundation program applications if you have published up to 2 published papers with a PubMed ID. And also, if your work is on this database, then other researchers can cite your work in their papers, and that's how kind of research evolves and blossoms. So that's what I would aim for as a gold standard. But then not all research tends to get published, but there are other ways to show your work. And this is when you can present your work at conferences. So there is an oral presentation, which is basically you talking about your research, and you describe to the audience the background, methods, and results, and then talk about the implications of your findings. And then there's poster presentations as well. So you create a poster, and again, you summarize these aspects of your research. And then generally at a conference, presenters would stand by the poster and answer questions from other delegates and judges. Good, so that was kind of my talk, but unfortunately, the 2 other speakers who were meant to be here today have had some technical issues, so I'm going to do my best to convey their content as well. So the first speaker who was meant to follow me was Tria Chakraborty, who's a 4th-year medical student at Oxford. So she's going to talk, well, her talk is about alternative ways of getting published. And effectively what her talk is about is how to develop a good foundation to develop the confidence and skills that you need to author literature. So there are three main avenues here. So the first one's student-run medical publications. The second one is opinion pieces in magazines. And the third one is kind of essay competitions and prizes that you can go for. Now, in terms of medical student journals, their main objective is to promote and value academic research and publishing amongst medical students. They give a student-friendly environment where students can submit their work, develop research-related skills, and familiarize themselves with the peer review process. And many of these journals that I've listed here are run and led by medical students. So there may actually be an opportunity for you to competitively apply and get involved from an editorial perspective. And that can help you yourself to learn how to sift through and critically analyze academic papers without falling foul of being gullible to whatever a paper tells you. And actually that can help you with your own academic writing skills as well. So I would strongly recommend that as an experience. The Student BMJ that I've mentioned here is a popular journal, but there are a few others listed. And it's worth looking into whether your own medical school has a student journal that you can be a part of. These are more for experiential gains rather than, say, something that you might refer to that counts for points, if you think like that. But this is more experiential and would definitely be helpful in an interview setting where you can talk about things that you've learned from publishing or editing sort of work in a student journal. So there are also student magazines and, my bad. There are also, student magazines and news journals that accept submissions regarding opinion pieces. And Tria, who is meant to be delivering these slides, has given a few examples of how her voice has been disseminated on important issues through these avenues. So this is definitely something that medical students can get involved with. And then, of course, there's also the mainstream literature. And there's a number of extremely well-written, popular autobiographical books authored by medics. And there's clearly a big market for this. So if you prefer a more literary style of publication, then this is probably something that you may consider doing, maybe not now, maybe at some point in your careers. This is the Coronavirus Collective, which is a feature that is introduced by our journal, Sushrita journal, which is affiliated with BAPIO. And this was designed for people to share their experiences during the pandemic, whether that be life under lockdown or on the NHS frontline. And it's more just a range of reflections and personal essays and poems from people in healthcare or students or family. And here are a few examples of these short insights into the lives of those who've submitted for this journal. So another thing that students can engage with is competitive prizes and competitions. And this is particularly valuable for your academic careers, your portfolios, your specialty training applications, because there are definitely points that are allocated for national prizes. And the Royal Society of Medicine in particular has an extensive list of prizes in various specialties, and they're awarded for research projects, proposals for research, as well as essay competitions as well. So we've linked that here, and I'd recommend that you check this out on your own time. And the studentmedic.com is again another website, which is quite helpful. It lists many of the essay competitions that are on offer. And what I would say is that they're definitely worth a shot, because not many people actually know about these opportunities because maybe they're not that well advertised. So your chances of success might actually be better than you think. So I definitely encourage people to scope out the opportunities, see if there's something that interests you, and just go for it, because you might be lucky and get a national prize through that route. So lastly, we've got 3 short tips from Tria. And she said, see what's out there. So scope your subject. Get involved with your university's journals and publications. And this is an important point. Don't be disheartened by rejection. In any of these stages or any of these forums or journals, you can definitely submit. And sometimes the editor doesn't feel that your work is appropriate for their journal for whatever reason. And do not take that personally. What I would then do is then look for an alternative journal that may take your work, or look introspectively and look at the work and see if there's anything that objectively needs to be improved. So it's either a question of, well, was the work appropriate, or was it of a suitable quality? So you might want to think about that a bit more. So for example, when it comes to journals, I'll talk about this in a second, we want to think about impact factor. And that was what the next speaker was going to talk about, Dr. Indranil. He wanted to offer an insight into what editors and journals are looking for and how to actually get published. So editors in particular, from his experience, they tend to accept timely pieces that are relevant to the current landscape in terms of academia, politics, or society. And effectively, they want the pieces that they publish to align with the journal's overarching direction. And it also has to align with the quality of that journal. And there's also the point that social networking has expanded the outreach and accessibility of research. And so now it's actually a big trend for healthcare professionals to promote, discuss, and engage with each other over social platforms such as Twitter and LinkedIn. And so this is quite an important point, sort of how to choose a journal for your work. First, you want to make sure that you go for a PubMed index journal. And there's a website here that you can go on to check whether that journal is PubMed indexed or not. And then what you want to do is make a list of all the available journals in your subject area. And then you want to look at sort of what articles they're publishing. And you can then vet these journals down by impact factor. Now, impact factor is effectively a sort of status symbol for how good a journal is or how impactful the publications are. So generally for a medical student, I think aiming for something like Nature or Lancet, these are pretty intense to aim for unless you've got, say, a PhD in the subject or quite experienced in it, because they have the highest impact factors. So I think to be sort of sensible and reasonable, you probably want to think about lower impact journals because your chances of acceptance are going to be much higher. So once you've sort of vetted down your journals to those that are of a suitable impact factor range and within the subject of your interest, then you want to make sure that the scope of the journal sort of matches that of your study. You want to check, again, the other types of articles that are published by the journal. So whether the journals publish commentaries, editorials, letters to the editor, reviews, and some of them may require you to get in touch with the editor beforehand. So you can email the editor and ask them, I've got this paper that I want to present, that I want to publish on topic X. And I'm going to give you a little bit of an abstract about this, what I've done. And would this be something that interests your journal, the readership of your journal? If so, then I'll go ahead with the submission process. If you say something like that, then you get it's quite an automatic way in to know if it's worth submitting to that journal. So then once you've kind of got the all clear from the journal editor, then you want to look into the journal a bit more deeply in terms of the peer review process, the author instructions, the readership of the journal, information about the publisher. You want to think about how long, they sometimes publish statistics about how long it takes for them to peer review. They publish sometimes about their acceptance and rejection rates. So then you can sort of learn a bit more about the journal and when you can actually expect to hear back from them and whether you've actually got a decent shot as well. Then you want to make a final list of the journals. Hopefully you've narrowed it down now to what you're going to do first, and then what your backup options are, maybe 2 or 3 backup options. And then you want to prepare your work to meet the criteria of that journal. And they'll publish very specific author guidelines that you should prepare your manuscript according to. And they may have additional forms that they need you to fill in, say for your author forms, and you need to get different people to sign it and so on. Good, so lastly, BAPIO would just like to promote their journals, Physician and Sushrita. And these are journals that students should feel free to explore and submit their articles for consideration. And we've linked some websites as well. I'd like to thank you all for listening at this point. I've spoken for far too long. So I'm going to move now to the chat function. Hopefully we can make it very interactive, get some questions and answers going. And I've linked you with my email here and also my LinkedIn if you'd like to connect. And if anyone wants to learn more, has any outstanding questions following the talk, then please feel free to get in touch, and I'd be happy to help in any way I can. Thanks, everyone. So we'll switch over to the slides now. Sorry, the chat function now.
Please aid me because it's time for me to in. Yeah, thank you. Hi, I'm back now. I'm sorry, I don't know, due to some technical reason. I'm back now. Thanks a lot, Ashwin. And I do appreciate the way and how much you covered with everything. And I'm sure people get loads and loads of information. Really, I can see some of the good comment about you, especially how you can cover the other people presentation. And thank you very much for that. There are a few questions. So one is about, are there any types of projects that have a greater chance of being published? Can audits and cubes be published?
Yeah, so just to answer that question, I would say the original research projects that I mentioned earlier, if I go back to the different types of projects that you can do, let's take a look here. Here we go. So I would say from these, the letters and correspondences have the biggest chance of probably getting published at a medical student level. I would say that audits and QI projects can be published. So from my experience, I mentioned the audit that we did at our general practice. You can actually convert the results of your audit into a letter to the editor, where you can present sort of the results of your audit there. And if it's making an important point, then that's what letters to the editor tend to do. So we had success with the British Journal of General Practice because it was a GP-related study. So there's definitely ways to turn around your audits and QI projects into publications as well. I would say that the original research studies, so the quantitative ones in particular, they have very sort of very high standards when it comes to those papers. So that can take a much longer process of submissions and rejections, or submissions and editing, until that eventually comes to fruition. So I would say that those are definitely worth doing. And my overall recommendation would be for medical students to try and get one or two experiences in most of these. You can definitely start with a short paper, try and get that published, or maybe try and get two published, just so that you're not worrying about, I'm just doing this for the points for the foundation program. So try and get those out of the way as quickly as possible, and then try and learn about different methodologies that you can do with less focus on, is it going to really get published? Because then at that point, it's more about the experience. So try and definitely do a systematic review, try and get involved in an audit, and try and get involved in one quantitative study. So if you can do one of these maybe each year, that would be great for your kind of research experience.
So in adding of the Ashwin comment, I would say yes, definitely. There is an opportunity to publish your QIP and audits as well. And there are different ways you can do it. If I say my own experience, the first audit which I did was a very small, even when I say small, it was 100%. And I did present it in one of the conference, and then it got published as an abstract, and that was the first step. But going that conference and presenting that my audit, I realized what are the other topics which are potential for publication or research. And you learn lots of new things, and then looking for other opportunity. And following that throughout my career, I managed to do a few research and get as an original article published. But it's just to start from. So if you have done any audits or QIP, I would definitely say looking for publication. Either you can start with the poster presentation, oral presentation, sending in conferences, and then either send as a correspondence or something in a publication. But there's a loads and loads of opportunity and way to get it published. Next question is here. Where is the best place to look for summer student safe? Ashwin, you might be the right person to answer this.
Yeah, so summer studentships generally are good in undergrad because your summers are quite long. I can speak for Cambridge because our undergrad is very distinct from our clinical years. So we get like 3 months off. And back when, it sounds like a long time ago now, back when I was in first year and second year, there was a website on, I think Christ College, Cambridge published a website of all the different sort of studentships that, I mean, it's not that only Cambridge students can access this. It was available just on their website. of like a list of studentships that people can apply to. And I think now that even if you just Google it, there's probably plenty of things that you can find just from a Google search. So look specifically for ones that are paid, because it's just a matter of access. I think most of these things, that some internships should, if they're doing it ethically, pay for you to be there, because I don't know, I'm a big believer of access, and I think that it's restrictive if they're not paying for it. So try and encourage those and apply to those ones that are paying for your time and paying for you to be there and paying for your accommodation, because you're a valuable asset. So take a look, Google. I think Google is your best friend when it comes to this. And I'm not sure if that Christ College website is still up, but when I was an undergrad, that was a very helpful resource as well.
In addition of that, there are loads of organizations, like I'm an anesthetics consultant, and I know from our organization, Royal College Anesthetics, Association of Anesthetists, Great Britain, Ireland, they have summer scholarship for the medical students. So please go through the organization and you will find some more opportunities there.
Yeah, sorry, that's a great point. Yeah, that's a great point. So specialty societies, definitely try and look at all of them, whatever you're interested in. They'll have dedicated stuff for medical students, so take a look. Thank you for raising that one.
Yeah. Next question, Ashwin, is what is the difference between letters and correspondence?
So actually, a lot of times these are just used interchangeably. Some journals refer to them as, that's just the editor. Some journals use them as refer to them as correspondences. I think that's merely a technicality rather than an actual difference.
Yeah, so
I don't know if you want to add to that.
Yeah, so correspondence is mainly if you're corresponding some particular, like replying to particular research project, or if someone already published an article and you got same so for example, if someone has done research in any one area and you have done project in the same area and you found the similar result or different result, you can reply as a correspondence for that article. And later, there are plenty of various ways for publishing letters, either any specific topic, like at the moment, Corona is coming up, so you can write a letter, how Corona is impacting on medical students' life. Or there are various topics if you want to pick up any medical condition and write a letter on it. But every publication or every organization, they have own specific criteria. So have a look and you'll get more idea what's the difference or what are the criteria they're having for their letter and correspondence. Next question, Ashwini, I think you are the more relevant to answer this because you are in that phase. Do publishing ground rounds have any value as a medical students? They seem a bit easier to get hold of.
Yeah, so I'd like to think of the value. I like to think of value in different terms here. So if you mean value in terms of will it probably count towards a portfolio application, then probably not. Will it count towards an interview discussion? Yes. Would it count towards your own development and experience in terms of publishing ground rounds and presentations? Then yes. So these are the questions you need to ask here. So if you're doing it for a portfolio purpose, then probably not. But yeah, maybe for other purposes, it might be helpful.
Thanks, Ashwin. And the other question is, are there any national groups of research which accept students from different parts of the UK, especially for students outside of London? So yeah, Ashwin is outside of London, so you'll be able to tell me exactly what the answer is.
Yeah, so national committees are actually a goldmine that I only discovered when I was in clinical years, so maybe in fourth year. So there's StarSurge, StarSurg. StarSurge are basically a national collaborative initiative for people who are interested in surgery. They typically do national audits where they get people in different regions involved in research and collecting data from their local centers and pulling that together to make quite a big, high-impact publication. So StarSurge is one. There's other equivalents as well, like NSAMR, which is, sorry, I'm not too sure what that stands for. The National Student Association of Medical Research. And that's another sort of national organization for students to lead and get involved in opportunities for research and audit. So look up NSAMR as well. I'm also going to do a shameless plug here. I'm a committee member for NANSIG, which is the National Neurology and Neurosurgery Student Interest Group. And we do a lot of very similar work where we create national studies and we get people involved in different universities across the country to collect data, and all of their contributions are recognized in whatever we produce, publications or whatever. I definitely recommend looking up general national organizations like NSAMR and StarSurge, or maybe things that are more closely related to what your interests might be. So for me, it's kind of neurosciences, and NANSIG was a great way for me to get involved in that. So there's plenty of opportunities for students, definitely.
Mm-hmm. So there's another question coming up. So do you have any tips for how international students can get engaged in research group here in UK?
Yeah, that's a great question. I would say that the best way in is if you can actually get a studentship or a summer internship that you can organize first, because that can then pave your relationship with a research group, and then you can continue to do remote work for them in your own time internationally. I don't think there's any harm in emailing groups to see if they would be interested in you working. So from my own experience, I've collaborated with researchers in America purely through getting in touch and networking and finding out sort of areas that I'm interested in. And then they can allocate work that you can do remotely. You don't necessarily have to be there. So there are definitely ways that students can engage in research internationally in that way, if that answers your question.
No, I agree with you, Ashwin. I think if they can just have a look, what are the national or what are the research committees lying around, email them, because most of us, we're looking for international collaboration. So if something research going on locally, and if someone from international wants to join, they're always more than happy to welcome them. And it's always the quality of research get different output when you get more data from different region instead of one region. So yeah, please have a look on our various committee and contact them directly. Now there is another question coming up. They say, do you have any tips for doing research alongside your medical study, particularly in later years of medical school with short summer holidays? Yeah, Ashwin has been involved and he'll be able to guide you for that.
Yeah, so main tip here is, again, being an accurate judge of your own capacity and your levels of commitment. If you have time, realistically, and you feel that you're not overburdened by things, then I would recommend using that time and trying to get involved in something. Sometimes they'll give you a lot of extra time during your clinical placements when you've got a lot of free time to do other things. I think that's prime time to get involved in a research project. SSCs particularly allocated dedicated blocks. So I definitely recommend, if the remainder of your placements are quite busy, definitely try and get something productive done in your SSCs. But ideally, it's nice to just have maybe one or two things just ticking over where there isn't too much of a rush to get it done, and just try and do it progressively as the year goes on. I mean, I have friends who've literally carried on an SSC project from 4th year. I think they've only just finished it now in 6th year. So there's no rush at times. You just have to be very clear with your supervisor, kind of your commitments and what their expectations are of you. And then you can kind of work together to make it a less stressful process, if that answers your question.
No, thanks very much, Ashwin. I think you clarified nicely. So our whole aim to doing this workshop is to explore or to make you all aware that there is an opportunity for academic in addition of your clinical work. And if you have question about how, when, what, how, I think Ashwin has answered most of the questions of your how, when, what. In terms of when, I think time is now. It doesn't matter what level you are. If you are a medical student, you can still involve. If you are junior doctors or if you're already in the training, there are plenty of opportunity. Only thing you have to just keep an eye on surrounding, looking for interested people who can guide you, and topic. Because when you work clinically day to day, there are plenty of questions come in your mind that why we treat patient like this or why this is not right. So it's better to think, not just hold your question or suppress your thought. Just think about how we can explore that. And one way to exploring, involving in the research project. By doing research, definitely it improves your clinical skill because it improves, you get more knowledge, saying what are the other options available. And it's like making you more knowledgeable. most important, not only involving the research, make sure it's getting published. By getting published, people know that it can be done or it's done successfully. It will help for other people to improve their clinical skills as well. So yeah, definitely getting published. There are plenty of ways to get published. We already discussed that. From BAPIO, we have journal Susruta, The Physician. Feel free to email us and we can always have a look. As it has been said, if there is a will, there is a way. So if you have a will to get involved in research, we'll be able to find out and help you to show you the way. I hope you all you found it useful. And thanks very much. If you want to get involved or have any question, feel free to email. Visit the BAPIO Training Academy website. And if you email the admin, they will be able to redirect your email to appropriate person. And we are more than happy to help you, support you. I think my time is up and we are exact on timing. Thank you very much, everyone. Thanks a lot, Ashwin, for helping and hope you all enjoy the rest of conference. Thanks a lot. Thank you.